everybody, I'm Journo Jess. Today I'll be speaking with Nurse Taylor Oakes, who is a resident of the state of Tennessee. Nurse Taylor is currently assisting with the COVID-19 pandemic in one of America's hotspots in Arizona at the Navajo Nation. The Navajo Nation is an American Indian territory which covers about over 17 million acres, occupying portions of northeastern Arizona, southeastern Utah, and northwestern New Mexico in the United States. More than 173,000 people live within these borders. Upon arriving at the Navajo Nation, Nurse Taylor was assigned to trace where the coronavirus cases were originating from, and she is here to share with me how she has been tracing the origination of where the COVID cases are coming from and how she has been coping. Hi, Taylor. How are you doing today?
Hi, I'm good. How are you doing?
I'm wonderful. Thanks again for speaking with me. I really appreciate it.
Yeah, of course.
So I guess just upon arriving at the reservation, can you kind of describe to me what you've been experiencing since you've been there?
Yeah, so I actually came in with the impression of when I was first contacted, they asked if I would be willing to work in the ER. So I said, sure. And then I got on the ground and they were like, actually, our greatest need is contact tracing, which I'll get into that a little bit later, what all that entails. But that is the greatest way of getting a hold on that. And so ever since, I've been working with the public health nursing department on the reservation and epidemiologist, basically trying to break down how this is spreading, how we can stop it, and how we can best provide resources to the patients that are suffering from the virus and serve them best.
Yeah. What's the sole, I know you're working at a reservation. What's the sole purpose of the reservation? And are you kind of like testing people for the COVID at the reservation as well?
So there's Indian Healthcare Services that is pre-standing and they've been here for a while. They are pretty much handling the testing themselves. And I think they initially were testing, I think about 500 people a day, which is pretty impressive. They said it has slowed down a little bit, but they're still testing 100 people a day. So like I said, that is Indian Healthcare Services. When patients test positive, that is when it is turned over to the public health nursing department, and we handle it from there. So the NGO that I'm working with is kind of helping support the public health nursing department with providing resources to the patients that test positive and how we can trace to prevent it from spreading and more people testing positive. So we're personally not assisting with testing, but it definitely is happening on a big scale.
Yeah. Is there enough resources available to provide the COVID testing?
For the testing itself, yes, there are enough resources for that, I would say. There's a lot of other areas that are definitely lacking resources, but as terms of testing, I do think they have enough resources.
All right. And I guess just going into like why you're there and what you're doing now, what exactly does your job entail?
So right now, my job entails basically whenever a patient tests positive, my job entails identifying what resources they need, seeing how I can help provide those, and then also identifying every person that person has come in contact with since their infectious disease period started. So then I will track down those people and we ensure that everyone that has been affected by this is quarantining based on the recommendations. And so sometimes, they need things to help them be able to quarantine, and we help provide that. And so it's really a great way to be able to help the community, because if you can help one person quarantine, that will stop a large amount of cases down the line. So like I said, I'm not necessarily out on the front lines treating COVID patients, but we are very much, our emphasis is on stopping the spread of this and providing resources to patients that have been diagnosed with COVID-19.
Yeah, and I know in the reservation, a lot of families live in very close spaces. There's a lot of people living in the homes. How are you able to, I guess, quarantine those people who do test positive?
So that's a great question. It is not uncommon for me to get a call of a person that has tested positive, and I'll ask, okay, who have you been in contact with since your infectious disease period started? And they're like, oh, well, I live with 9 people, 12 people, just because that is part of the Navajo culture. So we basically approach it with, if it's possible for them to isolate, we will do that. So that does sometimes entail, we have FEMA kits on the ground that includes tents, gallons of water, and food, but doesn't include electricity. So I personally can't imagine having 103-degree fever out in the Arizona desert, but people are doing it. Or they're sleeping in cars, in, barns, sheds, whatever, because they don't want their family to get sick. But that is happening. If it is just like a weak, older person that can't stay outside, we just recommend the family quarantine together and ride it out. And the entire family quarantine for the designated period. But we try to do every possible measure to get people to isolate. Whether that be isolated in a bedroom and then help provide them with bleach wipes, cleaning measures, whatever, to try to keep the rest of the family safe. But that's definitely been one of our biggest challenges and that is one of the reasons that it has spread so quickly and to the extent that it has in the Navajo reservation is because of the multi-generational households.
Yeah.
And just how many people live in a house.